All right, you ready to take a CPR class? That's what we're gonna do right now. We have the Perth Amboy Fire Department here. We have Chief Ed Mullen, and we're gonna get started this morning, a little crash course.
Good morning, Lauren, and
good morning
to all of the staff here at News 12, and thanks for having the Perth Amboy Fire Department here today. But we're gonna show you how easy it is to learn CPR. There's plenty of news stories out there that have a survivor that went into cardiac arrest because of early CPR, early 911 notification, early shocking with an AED. So we're here at the studios with News 12 to teach you how easy it is to learn CPR and what you can do in your own hometown, reaching out to a local organization or a private company, maybe a hospital, on getting into a CPR class. So you can learn CPR to save a family member, a friend, because if you learn it now, that's the chance that you'll give somebody for survival if a cardiac arrest happens.
This is so great, and you don't have to be a first responder either to do this.
Nope, we have to have it legally for our jobs, but anybody can learn it.
All right, so what do you say? We got our news director here, we got some producers, and we have our intern. You guys ready to go?
Yeah.
And we have Danny. Danny, you're gonna
Sure.
show us how to do it?
All right. First thing we're going to do is learn the first thing, like the chief said, early notification of 911. That's the most important thing. We want to get us there. You want to get someone there that's going to take over once you guys start. Most important thing is to get compressions, right? So if you're unable to do anything else, at least start doing compressions after you make that phone call. But the first thing we like to teach everybody is scene safety. You always want to make sure that you don't put yourself into harm going in to help someone else. So if the scene isn't safe, call us, stand back. If it is safe, get in there and start doing some compressions. Next thing you want to do is call 911. Again, if you call 911 from your cell phone, okay, make sure you tell them where you're at. Okay, if you're in Edison, tell them you're in Edison, and they will get someone to you, all right? Now it's time to start doing CPR. So the first thing we want to do is we want to check for responsiveness, okay? And if you don't mind, I'm going to use your mannequin. We want to check for responsiveness. Usually we could just shake their shoulders, say, sir, are you okay? Ma'am, are you all right? And check for responsiveness. When we do that, we're just checking for any type of breathing or moving or any type of movement whatsoever, okay? If they're not breathing or moving, and we're only going to check for no more than 10 seconds, we're going to get right into compressions, okay? We're going to do compressions by placing our non-dominant hand on the chest, dominant hand over, and we're going to push down and push fast, okay? At a rate of 100 to 120 beats per minute. You want to lock your shoulders. The other captains are going to come around and make sure. And the most important thing is you want to push fast, you want to push hard, and you want to push for about 100 to 120 compressions per minute.
Where do you want to press?
You want to push right at the sternum.
Oh, the sternum, okay.
Right at the chest piece, okay?
Lock out your elbows so it's not going
Yep, lock out your elbows and just going to push hard. You're going to push fast, okay? And we're going to do this for 30 compressions. I know you guys are just practicing here, but we're going to do 30 compressions, okay? Now, let's talk about doing CPR. You can stop for a second.
Okay.
When we do CPR, we're not going to do it up on a table. We're
Yeah.
specifically not going to do it on top of a bed. First thing you need to do is get someone down to a flat surface, okay? So you want them on the floor, because if you do CPR on a bed, you're just going to be bouncing off, okay? So we want to get them on the floor. If they're sitting in a chair, we want to lay them down. And again, there's the AHA, the American Heart Association, offers just hands-only compressions. So at that point, you guys are trained. You're ready to go, right? If in this training, you guys are going to get a little bit more. You're going to learn how to use the bag mount mask, and we're going to learn how to use the AED. But if you don't have anything with you, at least get some compressions.
All right.
Push hard, push fast at a rate of 100 to 120 compressions.
And we want to hear about all of this, so
Absolutely.
you're going to be sticking around. We are going to be right back, so stay with us. All right, we're back now, and just so everyone knows, this is not the actual class, right? It's like a 4-hour class, but we're getting a crash course right now.
That's correct.
Right, we have the chief here from Perth Amboy, the fire chief here, Ed Mullen, and yeah, this is just a crash course.
Yes, this is just to show you how simple it is to actually learn CPR and perform it if you ever have to save a life.
Okay, so what are we going to do next?
Next, we're going to turn it over to Captain Arroyo, Danny again, and he's going to go over adult CPR and using an AED.
Okay, so we talked before about doing compressions. If you don't have an AED and you have nothing, doing compressions is key. Do compressions, switch off with someone if you can until an emergency responder gets there. But if you have an AED, get the AED. You increase survivability of someone in cardiac arrest by a lot if you get an AED on board. So if you're at the mall, if you're at a public facility, a firehouse, a mall, anything like that, there should be an AED. If someone knows where it's at, they should go get it immediately. The way the AED works, it depends if it looks like this or it looks smaller or larger. They all work exactly the same way. The first thing you need to do is turn it on. That's a test question if we're taking the class. But we want to make sure that we apply the pads. There are 2 types of pads, adult and children. But we want to just make sure that they're open, and we want to attach them to the AED like so. Once they're attached, we could turn it on. And as you could see, there's pictures here to show you where the pads go on. I already have one here that's set up. So what we're gonna do is you guys are gonna go back to doing compressions and we're gonna work off the AED. The AED is gonna tell you everything you need to do. So we're gonna turn it on.
Mode. Call
Now
for
again,
help.
not a real AED, nobody's gonna get shocked here.
Do not touch the patient.
Okay, it's gonna analyze first. So when it says do not touch, everyone next to your mannequin will just put your hands up.
Shock advised.
The AED's telling us it needs a shock. So everyone gets your compressions. Right after we shock, we're gonna do compression. So everybody hands up in the air. The AED's working.
flashing shock
We have to
button.
shock this victim. So hit the shock button.
Shock
All right, everyone start doing
delivered.
compressions.
It is safe to touch
Arms
the
tight.
patient.
We're gonna do 30 compressions.
Now.
And if you have your bag, your mask, which we're gonna teach you how to use next, you're gonna give 2 breaths. 30 compressions to 2 breaths. And that's about 2 minutes or 5 cycles. And by then, the AED will be ready to analyze again, okay?
Continue for 1 minute.
All right, good.
45
Make your elbows a little
seconds.
tight. Push hard, push fast.
So if you're certified, you can actually do this, the AED, the shocking, all of that?
Technically, anyone could grab an AED anywhere and use it. You guys now have the training now to understand what's happening. As you can hear, the AED's telling you it has 1 minute and 30 seconds left that you guys
still
need
have
to
to
do
go.
compressions. Yeah.
Now-
And if you stop doing compressions, technically that person's heart is not beating. So
Okay.
they need you, right? They need you as much as they need the AED. Because while the AED is analyzing, you have to do compressions on this person.
I mean, how is it important that someone does it and not wait for responding officers or first aid?
So it's at least if you
Is
could
it
get
critical?
and do some compressions. I know it's tough,
Yeah.
but if you could get some compressions in there, especially if you're by yourself, it's very important because as you're doing compressions, you're providing circulation. It's a lot of work, huh, guys? That's why
I
we
give
work
up.
in teams.
It's hard. But I promise I won't give up on you if I
Pass it
ever
off,
see you
pass
in
it off to a
person.
nearby person.
If
Operator
someone
Yeah,
else
there
is
we go,
trained,
good.
he could take over now and do
Okay.
compressions.
Okay.
It's a team effort.
Yeah.
Now, we should be switching every 2 minutes. As you can hear, the metronome in the AED is going off.
Continue.
It's going to tell you to continue until it's ready to go, right? It's a lot of work to do compression. So if someone
Continue
else,
for 30 seconds.
so you have 30 seconds to go. So a good thing is if you're by yourself and you're in a public place, start counting 1, 2, 3, 4. If people hear that and I'm CPR certified and I'm off duty,
Yeah.
I'm gonna say someone probably is doing compressions because who else is counting to 30, right?
Yeah.
Come over there and get some help. This is easier if you get some help doing it, okay?
Cool. Thank you for this information on the adults. I think we're going to talk about kids
Continue.
Yep.
coming up next. And we have all this information, by the way, posted on our website at
3,
news12.com.
2.
Okay, so now we switched up our dummies here. We are now doing the infants. We have the fire department here from Perth Amboy, Chief Ed Mullen here, and yeah, we got infants in front of us now.
Yep, there's 3 different CPRs that we teach in the class: adult, child, and infant. So we have different mannequins for each of those sessions. So right now we're going to be learning infant CPR with Captain Arroyo.
So, if you're doing CPR on someone when they're adult, it's the worst day of their life, but it's probably the worst day of your life. You're gonna have to do compressions on someone that possibly needs you because they're dead, right? But when we work on an infant, that's even worse. No one ever really wants to talk about it, but it's very important that you know this stuff, okay? So as a layperson, if there is an infant that appears to be in cardiac arrest, we're gonna do the same thing we did for an adult. We're gonna check for responsiveness, but we're not gonna check this way. We're just gonna grab the bottom of their foot and tap the baby's foot. So everybody could practice that. And we're just gonna try to arouse the baby, see if the baby starts crying, moving, then we know that the baby doesn't need CPR, okay? So that's how we're gonna do. First things first, scene safe, right? Call 911, okay? And check for the baby's responsiveness. We're gonna look, listen to see if there's any movement in the baby for no more than 10 seconds. If the baby doesn't appear to be breathing, we're gonna start compressions, okay? And the way we're gonna do it, guys, and we went over this a little bit, we're gonna take our 2 fingers across the nipple line of the baby. We're gonna push hard, push fast at a rate of 100 to 120 compressions a minute. We're gonna do 30 compressions, all right, guys? So let me hear you guys count. We're gonna push hard, push fast. Go ahead, guys, do some compressions,
3,
okay?
6, 7.
And again,
8, 9,
good
10.
thing to do in this situation, if you have an infant, take the infant with you to the phone or put your phone on speakerphone, call 911, and remember, I'm here, I am in Edison, I am in Perth Amboy. Give them your address, and we promise you the 911 operator will get someone to you. In fact, 911 operators are trained to give you instructions over the phone. So if you're willing to, they will be able to explain exactly what I'm explaining to you over the phone so you could get some help to the babies, okay? So again, if you have hands-only compression CPR, this is what you're gonna be doing. Compressions, 30 cycles, okay? After 30 compressions, after 5 cycles, we want to just check to see if there's any change in the baby. We're going to look again, no more than 10 seconds. You could try to arouse the baby again too, okay? And again, if you know how to use your masks, you can place the mask over and give breaths, okay? And that's part of the course. If you take CPR, you will get that training too. You can use an AED pad on an infant, okay? There are infant pads that are smaller, but they can go on the infant the same way. And the AED will do exactly what we learned for the adult on the infant. It'll read it and see if it needs a shock.
And this is so important too, because when you're put in the situation, you're already on edge. So just having a little bit of knowledge could definitely help.
Just remember, get that phone call out to 911 and start doing compressions is the best thing. If the baby is not moving at all, after you check for responsiveness.
Okay, and we have all this information, by the way, posted on news12.com. And we're gonna come back and we're gonna be talking more about the kids, right? We're gonna do the Heimlich and things like that to keep kids safe.
Yep, exactly. If someone's choking, what do you do?
What do you do? We're gonna have that coming up. All right, so we're gonna talk more life-saving techniques. We have the Perth Amboy Fire Department here, along with some of our News 12 crew. Chief Ed Mullen, thank you for coming in this morning and showing us some life-saving techniques, which honestly can save lives for sure.
Exactly, and the whole premise of this whole segment is to teach how easy it is to learn CPR and also if someone's choking. So this next segment, we're gonna go over what to do if an adult, a child, or an infant is choking. And we're gonna teach you the simple techniques to opening up their airway, to dislodging something, because that is definitely a #1 reason why an infant could go into cardiac arrest is because there's airway blocked. So we're turning over to Danny right now.
All right, so if you have an adult choking, that person will be doing the universal sign for choking, which is, anybody have an idea? Exactly, universal sign for choking. All right, if they're truly choking, no airway, there's no airway exchange. So you're gonna hear, they're actually gonna look at you and they may not be coughing, they may not be nothing staring at you, just telling you, hey, I'm choking. First thing you wanna do is say, hey, I'm trained, can I help you when you're choking, right? And they're most likely gonna tell you yes, because they're choking. You wanna come around an adult, okay? You wanna place your hand over their belly button area, okay? Again, make a fist, hand over the other one, and we wanna do what's called abdominal thrust. We wanna go pull upward towards the abdomen. It's gonna look kind of like this. And we wanna pull up, over and over again. We wanna continue to do that until either two things happen. That object gets expelled from their airway, they start coughing, they're moving air now, right? Or the patient becomes unconscious. If they become unconscious, we're gonna assist them to the ground, and then we're gonna do CPR just like you guys were just trained, starting from the beginning, okay? So that's how we help with an adult.
I gotta ask you a question. How long does it take for someone to go away, right?
I wish I could tell you.
Is there a time frame?
I wish I could tell you. It depends on the person's airway. It depends on what they're choking on. But I'll tell you this, if you're not doing anything, it's gonna take longer. So the quicker you can start helping them, the better it is to get that object out. Now, if we're talking about an adult female who is pregnant, we wanna just put our hands over her belly, up in her chest, and do the exact same abdominal thrust, but up here in this part. We wanna avoid the pregnant belly, okay? For children, we wanna get down on their level. Kids are smaller than us. Same thing, any adolescent kid that can stand, we wanna get on one knee, and we wanna get behind them exact same way as an adult, but we're gonna do it for a child. When it comes to babies, things change a little bit because they're very tiny. We can't do abdominal thrust on them. We wanna make sure we have the baby supporting the baby's head. Again, if they're choking, they're trying to cry, but there's no air exchange, so they're basically just making the face movements of crying, but with no noise coming out. First thing we wanna do is place them in our hand, protecting their airway. We don't wanna cover their airway. We wanna place them on our forearm, okay? And we wanna give 5 back slaps. Facing downward using gravity, okay? We're gonna go 1, 2, 3, 4, 5. Support the baby's head, come back over this way using gravity, facing down again. 5 compressions, 1, 2, 3, 4, 5. And we're gonna keep doing that, okay? 1, 2, 3, 4, 5, until either the object gets expelled, baby starts crying, or the baby becomes unresponsive. Then we're gonna place the baby back on a flat surface and begin CPR like we did before. So you guys wanna practice this with the infants?
And how strong? Can you be super strong, or do you have to be delicate on a baby
Well,
and a
they're still
kid?
babies. You gotta be delicate, but you wanna use enough force to help try to lodge out whatever's in their throat. So let's all pick up our mannequins. Okay? Right, we're gonna start this way.
Yep.
Right, you wanna support their airway. You wanna put a little C over their mouth. Perfect. Come on over, point downward. All right, our instructors will help you out. It's okay. Put your hand here. Put your hand here. Flip over. There you go. He'll help you out. And everyone's gonna get 5 back slaps. 3. Very good. That's perfect.
Yeah, very good.
Nice job. Roll back over.
There you go.
Okay. Now using gravity, right? We want gravity. We want the airway to be open that way. We're gonna get 5 compressions. She's on it right there. 5 compressions, and we're gonna go back. And we're going to continue to do that until either the object is expelled or the baby becomes unresponsive. All right? Again, just knowing this basic technique can really help an infant in need. Most infant cardiac arrests are due to an airway problem. So if we could get that airway fixed quick, it'll bring the likelihood of getting that baby back quicker. And again, if the baby does go unconscious and we lose a pulse, then we could start doing compressions just like normal, just like you were taught before. But most importantly, make sure we get 911, right? Call 911, get us responders going, okay? And we will be able to come and help you. Remember, you could put that phone on speaker, 911, tell them your location, and we will find you.
And you offer classes for choking, for CPR, all of it.
Our training is through the American Heart Association. The training that you guys are getting today is called the HeartSaver class. It is for lay person, okay? EMTs, paramedics, firefighters like ourselves, police officers get something called BLS provider. It adds a little bit more techniques because we have a little bit more equipment, but really the training is almost literally the same except minus all that little extra stuff. So what you're getting today is what we're going to be doing for the most part, except with some fancy tools.
And you get your certification as well.
Absolutely. Actually, by the end of the day, you guys will all have your cert once we're done with the class. So
awesome.
Yep.
We'll post all this information on our website, news12.com.